Good morning, esteemed dignitaries, faculty, and parents here, and most of all, good morning to the young students over here. And I am honored to be here on the occasion of the significant milestone of the white coat ceremony, marking your formal entry into the medical curriculum. I am even more honored to introduce the chief guest for today, Dr. KJ Reddy. On behalf of everyone, I extend a very heartfelt welcome to Sir, who is a renowned orthopedic surgeon. His remarkable career and expertise make him the ideal person to be with us today on this occasion. Dr. KJ Reddy has an impressive 31 years in the medical field as an orthopedic surgeon. Following his medical education in esteemed colleges in India, Sir went on abroad to the UK and spent 14 years there building his clinical expertise. Since then, he has done extensive work in joint replacement surgeries. Sir specializes in complex primary total knee replacements and total hip replacements, along with joint preservation through several advanced procedures like stem cell therapy, ensuring cutting-edge patient care. Throughout his career, Sir has been recognized for his valuable contributions, notably receiving the Michael Bastow Audit Prize in 1993 at Queen Elizabeth Hospital in the United Kingdom. As examples to his leadership skills, he has served as president of the Indian Arthroplasty Association from 2015 to 2016, as well as on the Telangana Orthopedic Surgeons Association from 2016 to 2017. Currently, Sir serves as a board member for Arthroplasty Society of Asia and is also the chief joint replacement surgeon at Apollo Hospitals Jubilee Hills since 2003. In addition, Sir has also received and published several research articles to add to his credit. Dr. KJ Reddy is a trusted orthopedic specialist who uses his extensive knowledge as well as compassionate approach to improve quality of life and patient care. As a pioneer in the medical field who has changed countless lives, your presence here makes this occasion truly special, sir. And as a token of our gratitude, we would like to present Sir with a small bouquet which our Dean Sir will be presenting. Please join me in giving a warm welcome to Dr. KJ Reddy once again. We are very eager to hear your words of wisdom, sir.
Good afternoon. Thank you very much for your kind introduction that made my day. Respected dignitaries on the dais, Aparna Garu, known her for a very long time, Dr. Manohar Garu, Dean, know him for quite some time, and medical superintendent, faculty, students, parents, and the freshers. Congratulations to the new entries as well as proud parents. As Manohar said, we did not have the ceremony. I joined in 1980 Usmania, but we used to have freshers party. But I think this is a great occasion for you to start your career because you're so special in the society. Nobody else get so much of respect in the society because you are the future of medicine and you are the heroes of the people who believe in medicine. So you should keep that position special. I remember my days. I used to come from Dilsunagar to Usmania. Those days we used to carry our white coats. And on the road we'd put hand to the RTC bus. They used to stop. Because our white coat used to have a lot of respect. When we go inside the bus also, people used to look at us. We used to feel very proud. I'm sure there is, even now, doctors are respected, very well respected in the society, and we should live up to it. As Dr. Manohar said, keeping our ethical values, practicing medicine based on evidence, which is very, very important. And medicine is advancing so rapidly. Every day it changes. If you blink, new thing will come. So it is just the beginning of your career, and you have to go on till you practice medicine. And Dr. Manohar said that stress, there's nothing like no stress in the career or life. Everybody will have stress. The key is how to manage the stress. Very, very important. You should train yourself to manage stress, because we all get stress. Waking up in the morning, going on the road, driving, coming to the hospital, and dealing with your friend, everything is stress. But you have to manage. You have to have, everybody have their way of managing stress. What happens if you carry 5 kilo weight on your hand for some time, little heavy, carry about 20 kilos for 1 minute is okay. But if you carry longer, what happens? Your hand will fall, it becomes stressful. So the most important factor is, don't keep the stress in the mind. Forget about it. Move on. You have to manage. You have to learn to manage. I keep saying, because I've been attending so many things about Freshers Day, and I keep saying ABC, very, very important. In medicine, we call airway, breathing, circulation. But your career, ABC, your attitude, your behavior, and your communication. Your attitude is very, very important. When you come to the institution, just say hello, smile at people, even if you don't like them. Next time, they will be softer to you, and probably they become friends. Just say hello in the morning. Good morning. Doesn't matter. You are not going to lose anything. So your attitude is very, very important. And the way you dress, because people judge you, patients especially judge you, your colleagues will judge you, your professor will judge you, how you dress yourself, how you present yourself, very, very important. So present yourself in a presentable way. Behavior, very, very important. You have to behave with your colleagues, your parents, your professors, patients. You have to be very polite. I'm sure some of you met our chairman, beloved chairman. I met him 1996 in London. He used to come to London to recruit doctors in Apollo. I met him a long time back. And he said, whenever you come to India, because I never thought I'll come back to India at that time. Whenever you come to India, Apollo, Hyderabad is there. Please come and join. I came back 2003, joined in Apollo, never looked back. And when you enter his room, do you know, he gets up. He comes to you. He's a big man, legend, changed the corporate hospitals or the corporate healthcare in India. He is the visionary. Because of him, we are able to do so many wonders in medical care. So take him as an example. You don't lose anything saying hello to people, being polite to them. And communication. I keep saying communication is the key for your success. If you see any good doctor, his communication still so excellent, because medicine is nothing but communication. When patients comes to you in your clinic, talk to him nicely. 50% of the disease will go away. Talk to him nicely. This morning I saw a patient. We have two, of course, in NIMS also, we have two types of patients carrying big files. One category will be the genuine problem, have multiple treatments. The other one, normal person, had so many investigations, a healthy person. But his problem is, nobody is recognizing him. Nobody is talking to him. This morning he came, sir, I've seen, he came from Chhattisgarh. So many doctors, so many hospitals, nobody tells me what's wrong with me. So I made him sit down. He came with few people, spoke to him, asked him what he does, and spent some time. And asked him, took history, because listening is the key. A good listener is a good doctor. Listen to the patient. You'll get diagnosis. Then I listened to examine him. There's nothing wrong. I saw all the investigations. Spent a few minutes. Then I can see his change in attitude. Doctor साहब, आप पहले डॉक्टर हैं, पूरा देख लिया, पूरा सुन लिया, मेरा डिसीज खत्म हो गया अभी, आप बोलो कुछ नहीं है मेरे मेरे बॉडी में, I will be very happy. That's how people, because they expect you to listen to them, they expect you to see their reports, and the main problem is may not be the disease, something else is bothering them. So it's important, listen to them, communicate with them. And when you become a good doctor, you have knowledge, you have to have confidence. When you become confident, if you know the medicine and these subjects, initial subjects, anatomy, physiology, biochemistry, they are the foundations. Do you know many buildings, old buildings, bridges, they're still working, functional, because foundation is good. So you should have a sound foundation. Anatomy, unless you know normal anatomy, you won't be knowing what is abnormal. Like physiology, like biochemistry. And the next year, next semester, next term, you read about what is abnormal. Then in the final phase, you find out, together, find out clinically how the patient will present to you. So it's very, very important. Even at this level, at any level, these basic subjects are very, very important. So anatomy, physiology, biochemistry are important. And you have excellent infrastructure, I can see, excellent professors. Only thing is, you have to use them, communicate with them, learn from these excellent facilities created by Apollo group, Apollo family. And there is everything for you to become the top of the cream. Do you know in the past, most of the doctors, I think there was a survey about 10 years ago, 1/3 of doctors used to give up their profession, join something else. Those days, real estate was the thing. 1/3 used to leave abroad. Probably 1/3 stay in India, go higher studies. Probably now things have changed because opportunities are more. So you should be the top of the society. As Dr. Manohar said, you have to continue studying, reading books, spending sleepless nights. Then only you become the top. But do you know the most important thing is your health? Everyone will have so many problems, 1,000 problems. But once your health is spoiled, you have only one problem. That's your health. Day and night, you only worry about your health, nothing else. So your health is very, very important, especially your mental health. Unless you're healthy, fit, you can't become a good doctor, and patients won't come to you. You won't learn unless you are healthy body and healthy mind. So it is important that you keep yourself fit and well. I'm not saying 24 hours you read. Do you know what needs to be healthy? 3 things. You have to have good diet, good sleep, and good exercise. So throughout your career, stick to these three things, you will stay healthy. And of course, nowadays AI, artificial intelligence, is kicking in. Unless you know it, you will be extinct. Other day I was attending one of the AI meeting. They were saying most of the employees will be taken out, or most of the people will be unemployed. Yes, it is true. People who are not trained in AI, who do not have the knowledge, will become unemployed. But those who integrate AI, they'll be very successful. They'll still stay in the system, including doctors. We have to integrate. In Apollo, we have robotic systems. I do robotic knee replacement, robotic hip replacements. Robotics made our life very simple, precise, painless, and fast recovery. So you should be the innovators. There's so many problems in medicine. For example, you take knee arthritis, nobody knows why arthritis comes. You should investigate. You should do research. Find out why Indian people suffer from osteoarthritis more than anyone else in the world. So you start looking in those research point from the beginning. Then only you will become the leaders in the medical society. I can go on forever. Most important thing in your life is your health. Next most important thing is your parents. They work so hard to bring you to this level. They are very proud of you, and keep them proud rest of their life. Do you know your success gives more happiness to them than their own success? Wish you all the best. Have a great afternoon. Thank you once again for giving me this opportunity.